We will move on to the topic diagnostic measures. Chest X-ray. It helps to provide information regarding the anatomical location and appearance of lungs. It is contraindicated in pregnant women. And common X-ray findings are in COPD there will be this areas of hyperinflation or overinflation, that means enlarged lungs. In asthmatic patients, hyperexpanded lungs, flattened diaphragms, narrowed cardiac shadow. In pulmonary edema, it occurs with this acute asthma. Bronchial wall thickening can be seen. In bronchiectasis, honeycomb appearance in chest X-ray, that means ring-like shadow can be seen. In pneumonia, lobar or segmental consolidation due to fluid collection. In tuberculosis, multinodular infiltrates with calcification in the upper lobes. That means it can able to show the damage in your lungs, but you might need further tests to prove that you have this tuberculosis. And in pleural effusion, mediastinal shift present. That means it's a condition occurs when a severe injury in the chest causes the entrapment of air in the pleural space. And as the volume of air increases on an affected side, this lung will get collapsed, and that organs and tissues of this mediastinum, it is crowded with this opposite side of the chest. And we'll see about the sputum examination. Early morning sterile specimen is obtained either by expectoration or by tracheal suctioning. That means you are sending the sample before starting this antibiotic therapy to rule out what type of microorganism it is. And laryngoscopy, it's the direct visualization of larynx, trachea and bronchi with the fiber optic bronchoscope. That means with the use of this fiber optic bronchoscope, you can able to visualize close-up view of the larynx and throat and trachea. So before procedure, ask the patient to remove all the dentures and maintain the client on a semi-fowler's position after the bronchoscopy. Then bronchoscopy, insertion of a fibroscope into the bronchi for diagnosis and biopsy collection for diagnostic purposes. A thin tube containing a light and camera, it is inserted to examine the lung. And next one, pulmonary angiography, an invasive procedure in which a catheter is inserted via the femoral artery into the pulmonary artery to rule out any abnormalities. That means it's a test to see how your blood flows through the lungs. So you have to quantify any allergies for dye before the procedure. Then the thoracentesis, incision of the needle through the chest wall into the pleural space to remove fluid or air for the specimen or the diagnostic purposes. Then the pulmonary function test, PFT, means it's a test helps to show how well the lungs are working. So this test measures this lung volume, capacity, rates of flow and gas exchange and all. It helps to treat the lung disorders. And this test is contraindicated in children less than 5 years of age because they couldn't able to follow the instructions. Then lung biopsy, it is used to detect any abnormalities or malignancies. The position used for lung biopsy is prone position or decubitus position. Then the pulse oximetry, it's also a non-invasive procedure like PFT. It used to measure this dissolved oxygen in concentration in the blood. Normal saturation, we all know that from 90 to 100%. If it is less than 91% means immediately notify the physician. If it is less than 70 means it could result in life-threatening complication. And tuberculin skin test, Montex, it's a test used to determine tuberculosis infection. That means first you have to take this 0.1 ml of solution from that 5 units of tuberculin. That means purified protein derivative PPD is administered intradermally to the client's forearm. Then you have to monitor the site for induration between 48 to 72 hours. If the induration is more than 10 mm means the test is positive. If it is below 5 mm means the test is negative. If it is between 5 to 10 mm means the patient is affected with that infection or the patient has become immunocompromised. Next we will discuss about the topic arterial blood gas analysis. It measures this dissolved oxygen and carbon dioxide concentration in the arterial blood and to find out the acid-base balance. So indications of ABG, you can able to perform ABG, those who are having this respiratory failure in acute and chronic states, any severe illness like cardiac failure, liver failure, in renal failure, hyperglycemic states, sepsis, burns, poisons, ventilated patients. You can able to perform on these patients. Then the nursing care. Before performing this ABG, you have to do this Allen test. Allen's test means elevate the hand and make a fist for approximately 30 seconds. Apply pressure over the ulnar and radial arteries, occluding both. So open the hand, which will be blanched. That means you have to look for perfusion. You have to release pressure on the ulnar artery and look for perfusion of the hand. This takes under 8 seconds. If there is any delay, then it may not be safe to perform radial artery puncture. So a positive Allen test means that the patient doesn't have an adequate dual blood supply to the hand, which could be negative indication for this catheterization or any other procedure which could result in occlusion of the vessel. And after ABG collection, so you have to apply pressure over the site for 10 minutes. Then we will discuss about what's the difference between this respiratory acidosis and respiratory alkalosis. This respiratory acidosis means when the lungs cannot remove enough of the carbon dioxide produced by the body. So, and the causes are hyperventilation, in which all conditions like asthma, pneumonia, CNS depressants, brain trauma, and pulmonary edema. And the manifestations of respiratory acidosis are increased respiratory rate and hyperkalemia. Respiratory alkalosis means when you breathe too fast or too deep and CO2 level it drops too low. Hyperventilating the patient causes, in which all conditions means fever, hysteria, pain, hypoxia, mechanical ventilation. You can able to see this respiratory alkalosis. In manifestations, decreased respiratory rate and hypokalemia. Management for respiratory acidosis is you have to administer oxygen to the patient. Management for this respiratory alkalosis, you have to limit the oxygen. Then the respiratory medications. There are two types of medication, bronchodilators and then corticosteroids. These bronchodilators, I'll give you this example for oral bronchodilators, dariflin, theophylline and terbutaline, and inhaled bronchodilators are albuterol, salmeterol and formoterol. These bronchodilators, helps to dilate the lung airways. And corticosteroids, it is used to provide relief for inflamed areas of the body. So it helps to lessen swelling, redness, itching and other allergic reactions. Oral corticosteroids are methylprednisolone, montelukast, and inhaled corticosteroids are fluticasone and mometasone. Nursing care, have to monitor for peanut allergy in case of administering anticholinergics like atropine bromide. So before giving this atropine bromide, monitor the patient for any allergic to peanut. And monitor serum theophylline. Normal theophylline level is 10 to 20 mcg per ml. If this serum theophylline is more than 20 mcg per ml means it is called a theophylline toxicity, and it is manifested with symptoms of tachycardia, nervousness and irritability. Monitor the heart rate while administering dariflin to the patient. Then we'll discuss about the disorders. Respiratory disorders or disorders such as asthma, COPD, pneumonia, pleural effusion, empyema, and tuberculosis. If it is left untreated, it can produce this health complications or life-threatening complications to the patient. And due to any triggering factors, IgE mast cell mediated response occurs. So infiltration of this eosinophil increased ESR count. Infiltration of eosinophil means it's a characteristic feature of asthma. It results in chronic obstruction of the airflow. This COPD complications are pulmonary insufficiency, pulmonary hypertension and carpulmonale. Carpulmonale means enlargement of right side of the heart. So management to prevent these complications are corticosteroid and then immunosuppressant therapy. So after that infection, after this COPD infection means pneumonia, and that means fluid collection. Fluid collection in the pleural space means pleural effusion. It results in pus accumulation. That means if this fluid collection is left untreated means it will become very thick, opaque and foul smelling, results in empyema. If this empyema is left untreated then it results in this tuberculosis, multinodular infiltrate with calcification in the upper lobes.